Good afternoon, and thank you for joining us. This is the Return to School Support Town Hall from Children's Hospital New Orleans, offered in partnership with the Louisiana Department of Education. Today's topic overview will include an update on COVID-19 in Louisiana, and then we'll primarily focus on janitorial tips and guidelines on cleaning in schools. We'll end on a commentary around physical education, or PE, and then we'll be sure to include answers to any questions that pop up throughout the town hall. We'll be offering town halls throughout July and August for schools to participate in, and each session will be recorded and posted to the Louisiana Department of Education's website, as well as the Louisiana Believes YouTube channel. During the session, if all participants would please submit their questions through the Zoom chat option and direct them to panelists only, we'll be able to condense those questions and incorporate them in our dialogue today. If there's any questions that we don't get to, we'll make sure to send them on to the Department of Education so that content is posted on their website and you all have the guidance that you need for your questions or concerns. Today, we will be referencing the most up-to-date Louisiana Department of Education school reopening guidelines and resources, which is available on their website. Those were released on July 15th, 2020. Additionally, if other questions do come up, feel free to submit those to the Department of Education through LDOE COVID-19 support at la.gov. Those questions will then be incorporated into a dynamic FAQ document that will continue to be updated. There will also be Strong Start reopening office hours provided for schools every Thursday from 3 to 4 p.m. starting July 23rd and lasting into the first week of September. As far as Children's Hospital New Orleans resources go, we do have a hotline that will be available to schools for any medical questions pertaining to an individual. That hotline is 504-837-7760. Additional resources available through this hotline are at-home symptom monitoring and return to school screening and virtual care services. We also encourage participants to visit our website to check out resources that we have for all stakeholders, whether it be students, parents, or schools, and information about COVID-19. In August, we'll be looking to roll out PR and signage toolkit for schools, as well as parent support. We'll go ahead and get started with an update on COVID-19 here in Louisiana. Our first speakers are Dr. Cade Brumley, the Louisiana State Superintendent of Education, and Dr. Leron Finger, our Chief Quality Officer here at Children's Hospital New Orleans. Dr. Cade Brumley, do you have any opening remarks you'd like to make?
Hey, this is Cade Brumley at the State Department of Education. Just want to take a moment and thank all of the dedicated professionals at Children's Hospital of New Orleans for their tireless collaboration with us to make sure that we have put forward health and safety standards for our schools to utilize as they make decisions on reopening and school models. I know that the standards that we set forth for the state of Louisiana, which are minimum standards, are on par with or better than anything that you'll see in this country, and that did not happen by accident. That happened because our team worked hand in hand with medical experts such as those at Children's Hospital so that we could put forward information that's helpful to our schools as important decisions are being made. We think that moving forward, it will be really important that we maintain collaboration with Children's Hospital of New Orleans, and further, that local school systems also maintain that collaboration and build those relationships with the experts there at Children's Hospital. I know that Children's has done work to ensure that they are being as supportive as possible during this pandemic to our school systems, and for that we are very thankful, and we look forward to a continued partnership as we learn more about this virus and more about how to safely operate our schools in the upcoming months.
Hi, this is Dr. Leron Finger from Children's Hospital in New Orleans. I serve as the Chief Quality Officer here at Children's Hospital and also have overseen our response to the COVID-19 pandemic in the year of 2020. Over the last several months, I've gained a lot of experience in understanding this disease, how it uniquely affects children as well as adults in our community and within the hospital. And with that in mind, I'd like to share with you a little bit about what is going on now and what we might foresee in the upcoming several weeks and months. First of all, As a professional, I wanted to thank you for working as educators with our children in New Orleans and across the entire state of Louisiana. Personally, as the father of 3 girls who are rising 6th, 4th, and 2nd graders, I thank you for your tireless efforts to educate both in person and via remote access if that is indeed necessary. Where we are right now on July 24th, the COVID-19 pandemic is ongoing with its ugly head. To date, over 95,000 people have been diagnosed with COVID-19 in the state of Louisiana, and approximately just under 8,000 of those are pediatric patients or children under the age of 18, which is just under 8% of the total. We know from following the news over the last several months that children are uniquely less severely affected compared to the adult and older population. However, they can still be affected. Although they need to be in the hospital much less frequently than adults who are affected by COVID-19, there are still some children who do get sick with this disease. That being said, by far a more profound impact on children might be their mental health over the last 4 months. They've been out of school in the spring semester and really void of any real clinical group activities over the summer because of the phasing of our lockdowns over the last several months. Moving forward, as we look towards potential return to in-school learning in the fall semester, I think there's some really important take-home, big-picture points to take away. Number one, if any student or team member is sick, they need to stay home. Long gone are the days when a parent can give a child a dose of Motrin in the morning at 7:30 and drop them off at school at 8 a.m. In the age of the COVID-19 pandemic, that's simply unacceptable behavior. We need to educate the parents and guardians of our children, as well as all of our team members, that part of the expectations as a community in Louisiana and as the world is we need to be comfortable staying home if there's any signs of illness. Number two, the next major take-home point is that wearing a mask absolutely helps mitigate the spread of the disease. The Department of Education in the state of Louisiana has sent some guidelines for who should wear a mask on campus, and some local school districts have taken these guidelines and asked for them to be a little bit more stringent. I would encourage you strongly to abide by these guidelines, as we have seen over the last 4 months of this pandemic in North America that mask wearing can absolutely help to stop the spread of this disease. It's not to be taken lightly. The last thing, the major take-home point, is that socially or physically distancing from other people can also help mitigate the spread of this disease. That doesn't mean you can never be within 6 feet of someone, but when able to be, and when sitting in a situation inside for a long time, being spread apart by 6 feet absolutely will be another factor to help stop the spread of this disease. When you combine all of these things together, staying home when you're sick, wearing a mask, and socially or physically distancing, those 3 things by themselves will do an enormous amount of good in stopping the spread of this disease. Thank you for joining us for today's town hall.
Thank you, Dr. Finger. Next, we'll move into a fundamental guidance review presented by Dr. Tony Gonzalez, who's our Children's Hospital New Orleans School Wellness Medical Director and Service Line Chief of Orthopedics. Dr. Gonzalez is extremely passionate about supporting schools and has led a successful sports medicine program in the surrounding area. He now works closely with Dr. Finger and our team of COVID-19 guidance experts and infectious disease specialists to support schools in the reopening process.
Before we go through the janitorial tips, we would just quickly like to touch on the fundamentals of COVID prevention. First of all, we'd like to say that with what you have, you just need to do the best you can and stay flexible. There will be recommendations that come out, and as our studying of the COVID transmission increases and studies improve and we get more information about what's going on and how things go as we start to reopen and increase our phases, these guidelines may change. So please stay with us and stay up to date, but don't get frustrated. The farther we go along with this, the more accurate our information is going to become. And so by following the latest recommendations, we're going to do better at preventing transmission. For masks, there have been multiple questions about the types of masks and the thickness of masks and how to take on and off. At this point in schools, we are only recommending fabric face coverings per the CDC. There are no thickness requirements. People have asked about bandanas and buffs or neck gaiters. Are these possible? Can you wear them? And you can. We ask that you use face coverings that cover the chin and don't hang down straight unless they hang all the way to the chest. By hanging down and not coming up underneath the chin or going to the chest, water vapor, which may contain viral particles, can escape easier. It's one of the reasons that we don't advise to use face shields instead of face cloth coverings. The face shields tend to fog up and can allow water vapor to escape around. Whenever you take off your fabric face cloth, we ask that you take it off by the ears. Please do not touch around the mouth. And also, try to clean it daily. If it becomes grossly contaminated, if you sneeze or cough and there is something on it, please exchange it for another. Wash your hands before and after. With cleaning, you can use normal soap. There's no special detergent or disinfectant that you need to use. Just please wash it once a day or, again, when it becomes grossly contaminated. As far as kids with special needs, these kids will be well documented within our system. They will have IEP or 504 plans. There will be some kids that will not be able to mask. With that, we ask that everybody that comes into close contact with them wash their hands and mask as much as possible. Kids with asthma, we are trying to move them from nebulizer treatments to MDI treatments or meter-dosed inhalers with a spacer. This will allow kids to take in the full breath of the medicine without exhaling any water vapor during that time. For social distancing is meant to decrease transmission. In that transmission, people, as they speak, tend to exude some water vapor with their breath. These water vapor contains viral particles, and approximately 6 feet is a good safety measure so that the water particles fall down to the ground instead of coming in contact with us and subsequently get breathed in. With that, by socially distancing or staying more than 6 feet for more than 15 minutes, you decrease the transmission. For that fact, and patients or students who are symptomatic or at the school, we would ask that they be moved into an isolation room. There have been multiple questions about how long they can stay in the isolation room, how many people can we put into the isolation room, what's the maximum number, can they leave and go to the bathroom. At this point, we would like for them to be socially distanced. You can have a child with just a fever or a flu in there along with someone who's potentially positive. And so we would ask that you try to keep them socially distanced if possible. If not possible, try to keep them as far apart as possible. Once they leave, you can wipe down the area and clean it as well. If you have multiple students where the isolation room's becoming overcrowded, you may have to use another room and then clean it also. Within the room, the people taking care will only need to wear masks. If they are coming in contact, touching the students for any reason, we would ask that they wear gloves. If someone is actively coughing or has a dry cough or a cough that they can't stop, please have a mask on them. and at that time it may be appropriate to wear goggles. The patient or person that's in the isolation room can go to the bathroom and come back as long as they're accompanied by somebody with a mask. There's been questions, should I have a special mask in dealing with patients in the isolation room? At this point, there is no special mask that's recommended, even in our facility. When dealing with patients with cough or fever or flu-like symptoms, we don't wear a special mask. We use standard masks in dealing with those patients. Specialized masks are only for people who are in close proximity to the mouth during an aerosolizing procedure such as intubation. When kids are in class, we would ask, or when kids are seated at tables, we would ask that they all face the same way. This allows the water vapor to go forward and fall down, as opposed to being facing each other where it can go back and forth. There's been multiple questions about physical barriers, including plexiglass shields and face shields. There will be some didactic lessons. There will be some patients with hearing needs, or sign language or reading lip needs. Some students that have second language classes that will need to follow the teacher's lips. With that, we would ask that the teacher step back. In these cases, face shields may be better than nothing. Also, some people are putting in plexiglass shields in the offices or at teachers' desks where the face needs to be visualized. We still ask that this is not a replacement for fabric face cloths, and we still ask that you be social distanced during this time. Symptom monitoring, the CDC has recommended that it be done twice a day. Currently, schools are doing this because this is a high transmission state. Schools are doing this so to provide a screen before moving into an area of multiple people. With that, temperatures will be checked. Typically, these will be done with infrared readers. If someone has a temperature greater than 100.4, they will be moved to an isolation area. The most common symptoms in someone positive for COVID-19 are fever, shortness of breath, and chest pain. So fever is the best symptom we have in order to check for people with symptoms for possible transmission. There's been some questions about thermometers and what types and whether we need to add a degree or take off a degree. We would encourage you just to use the same temperature, state whatever it says on the back, do not add or take away, and do it consistently so that you have accurate results from one day to the next. There have been some questions about whether someone sitting in a hot car or a hot bus will have an elevated temperature, and most of the schools have gone to if someone is borderline, has a 100.4 fever by infrared thermometer, to sit them down for 10 minutes in the isolation room and recheck it. If the temperature goes to normal, then they would be allowed back into the classroom. If it does not go to normal and still elevated, then your standard protocols for a symptomatic student at school would take over. How do we determine between symptoms such as runny nose, allergies, colds, and COVID-19 symptoms? Typically, if a cough is worsening and dry, then it needs to be addressed. If a runny nose is associated with not feeling well or malaise and congestion, then more than likely it will need to be addressed. This is where our primary care providers will assist us in this because they know the patients better than we do. If someone has a runny nose due to allergies and they have always had allergies, then that is not as important of a finding as fever or congestion or malaise associated together. The Office of Public Health will assist you on when to test. Testing will occur at their recommendation or the recommendation of the primary care provider. It is possible that there will be parents or employees or students that have a difficulty getting in touch with their primary care provider, and the Children's Hospital hotline can help you determine where testing is available for those people. They will also assist you in where testing is available for children or families with special needs or other difficulties in getting care. For cleaning, it is important that we identify highly touched areas. Highly touched areas are areas that are touched by multiple people in a short amount of time. These are consistent with doorknobs, stair rails, bathroom door, sink handles, water fountains, as such. And so with this, we will need to wash those on a regular basis. That means multiple times a day. Smaller items that are shared, potentially between one person, are not shared at all, are lower risk for transmission, and subsequently should be prioritized as such. One of the questions that has come up is books. If books are shared by only one person and not through multiple people in a short amount of time, then it would not be considered a highly touched surface, and either gentle wiping or left out of circulation would be acceptable for those items if anything is required. Remember, low touched items can be wiped down at the end of the day per normal cleaning. Also, protocols will change in an office setting where the secretary, administrative assistant, or administrative personnel used to see several kids in a short period of time. Now with the current policies, more than likely kids may not present as much to those areas. Multiple people, including visitors, may not present as much to those areas, and subsequently may not be a highly touched area need subsequent cleaning. So as we move into the reopening of schools, the policies and areas will need to be reassessed and adjusted per those distinctions. With that, janitorial tips. The greatest challenge we've experienced here at the hospital is leveraging our existing resources. Our environmental crews will have a lot more to clean, keep track of, and possibly do during these times. And so it's important that anytime someone can assist with them, where someone can assist in taking out the trash, someone can assist in wiping down a highly touched area, someone can assist in doing smaller details, it will be greatly appreciated. Remember, we need to stay united in this and work as a team, and that will give us the best effort moving forward to be successful in preventing transmission. Also, we need to communicate with our fellow workers and have some flexibility so that different people may be able to do different cleaning items or check boxes at different times so that the entire work schedule can be done in an efficient manner. As we stated before, strategically, we need to identify those highly touched areas and categorize them in highly touched areas, concerning areas, and areas of less concern, and dictate the cleaning protocols appropriately. We want to approach all stakeholders, including teachers and students that can assist in sanitizing their immediate environments. For instance, One thing we did here at Children's Hospital was have our administrative assistants in the offices clean their local areas and work on taking the trash out to leave environmental crews open to taking on more responsibilities in other areas. And this may need to be done in your facilities as well. Keep your communication strong. Currently at the hospital, we have weekly update huddles so that problems or areas of concern can be identified and addressed quickly, and we can adapt our plan to changing protocols. Checklists have been important so that we can make sure that every highly touched area is addressed in the reasonable time and in an appropriate schedule. Also, the checklist helps as crews move through. If something needs to be done because somebody else is a little busy, then someone can step in their place and take care of that action item. We encourage flexibility. We encourage you to stay positive. Again, as we stated previously, in unison, working as a team, we all tend to do better. As we all know, we love our saints. We've seen how our saints work better when they are a team. And through working as a team, we can achieve all our goals and help prevent transmission of COVID-19. As we've stated previously, the CDC guidelines may and more than likely will change, and please stay up to date, follow us closely, and I encourage you not to get frustrated by the changes. As more scientific data comes out, we're going to update you with the latest and most accurate information to try to prevent transmission at your facility. We also encourage you to think about first impression areas during drop-off points and offices. Parents' anxiety will be addressed depending on the cleanliness of that area. If we keep that area the same way we keep the rest of the facility, parents will feel more comfortable, students will feel more comfortable, their anxiety will be less, and we can move through this in a unified fashion to provide the best area for prevention of COVID transmission. The CDC has developed a sheet within this talk discussing plans, implementation, and the ability to maintain and revise that plan. We've talked about most of this prior, the importance of keeping areas disinfected. If an area becomes grossly contaminated, is actively dirty, is wet for some other reason, we want to clean that area with soap and water or some other cleaning solution and then disinfect after it's clean. Please follow the labels on the disinfectant. As we move through this, people become anxious and want to overclean, want to clean multiple times, even with no gross contamination or no active use. Sometimes that will cause an overuse of the disinfectant, which may lead to airway irritation. If that's the case, please return to the CDC guidelines for effective products and disinfectants, and a switch to another disinfectant may be necessary. Also consider your resources and equipment. People cleaning will need to wear appropriate protective equipment, including masks and gloves. And we want to maintain our safe practices, including wearing fabric face cloths, hand washing, staying home if you're sick, and social distancing, even in our environmental crews. As we stated before in our cleaning guidelines, we want to prioritize highly touched surfaces. Currently, smaller items such as pencils, chairs, bleacher seats, floors, whether they be carpet or hard floors, are not considered highly touched areas. If someone has gross contamination appears on the floor, then that area will necessitate cleaning and disinfectant. but in normal use, the floors are not considered highly touched areas. Naptime blankets, we would encourage the children not to share, but otherwise need to be cleaned on a regular basis. Highly touched areas will need to be cleaned frequently or multiple times during the day. We will use your judgment as how to do that best at your facility. We will also ask that you use your judgment and differences between cleaning at different areas of your campus. You know your facilities better than we do, and so therefore you will know which areas need to be cleaned at different rates than others. Like we stated previously, nurse's office, reception desk will have altered protocols and policies due to different structuring from the COVID return to school response. This may turn a highly touched area into a regularly cleaned area, and so therefore you may need to adjust your policies as such. In areas where you treat kids and in isolation rooms, you will need a regular wipe down area and to be cleaned after any possible symptomatic child. In classrooms, areas such as desks where kids stay at the same desk all day, every day, will be considered a regular area and be cleaned as such. In areas where kids are rotating classes, it is considered a area of extra cleaning. Again, highly touched areas are areas such as doorknobs, boards where multiple kids are using in a short period of time, bathroom doors, rails and doors leading to stairwells are moving in and out of rooms. Currently, most schools are not using locker rooms, especially if social distancing cannot be maintained. As in most of our facilities, we want to prevent congregation of students, and in locker rooms, it's difficult to prevent this. With that, if locker rooms are used, you will need to clean them on a regular basis, and if they're used by multiple kids in a short period of time, they will need to be considered highly touched areas and cleaned multiple times a day. Most schools are going to using school uniforms and what the kids come to school in for PE instead of having them change out to prevent locker room use. You will have to change some of your procedures with bathrooms. Before COVID-19, more than likely kids were allowed to go in groups to the bathroom and therefore congregated outside while the bathrooms were being used. We want to prevent that, so we need to make sure that kids go in appropriate groups or sizes, or appropriate groups of sizes of children so that congregation does not occur. We will also have to adjust cleaning schedules that as large groups go in, we will need it cleaned before multiple groups can go in again. In the library, books have not shown to be a high transmission vehicle, and so subsequently will be treated as a regularly touched object and would go through normal cleaning protocols. Playgrounds, most of the playgrounds will be used by static groups or cohorting groups, and so therefore if kids are not socially distanced within those groups, then we would encourage you to wipe down playgrounds as a highly touched area, but subsequently would not prevent kids from using the playground. On implementing cleaning guidelines, we want to manage our high traffic areas and entry points. We subsequently need to check our screening. If we are in a low number or low capacity school where screenings can be done effectively At drop-off points without any congregation, they can be done there. Otherwise, most schools that are high capacity would subsequently do their screenings within the homeroom for that school or for that student. Also, some schools are doing the screenings at entry points. As long as, again, kids are not congregating at those points and they can socially distance, then that is okay. If you find that kids are backing up, then you may want to change your procedure to do it in a homeroom. We don't want to overdo, again, our cleaning agents. Sometimes stronger is not better and more is not better. We want to do it appropriately so as not to have proper disinfectant but not cause any added irritation. We want to have strategic conversations with our suppliers about the type, quantity, and timing of disinfectants and proper personal protection equipment. We want to make sure our facilities management and environmental teams follow all guidelines with hand washing, wearing masks, and social distancing. This is especially important because these teams tend to be smaller, and if someone has to self-quarantine due to possible exposure, there will need to be backup plans to facilitate cleaning in their absence. Water fountains are considered a highly touched area and will need to be cleaned appropriately. We are currently not considering floors and carpet as highly touched areas, and so therefore would do normal carpet management as per previous protocols. AC vents, air filters, air purifiers are only recommended per your previous protocols, and there does not need to be any additional upgrades or recommendations except for as previously recommended per normal maintenance. For physical education, we are asking that kids social distance as much as possible. If you do go outside, you can expand out that social distance even more. We ask that they try not to run in small groups, but spread out. You can have more than one group in a large gym if the area is partitioned and you don't have crossover of groups. We try to stay outside as much as possible. We recommend trying to clean between groups. Some schools have separated out their equipment so that teachers can alternate different equipment for different classes and set up a cleaning protocol for them once they're done. Again, if you have any questions or any other concerns, if there is something that we haven't covered, please feel free to contact us about your concerns. Thank you for this opportunity to talk to you. We appreciate everything you do for us and our children. It is extremely important that we provide the best care for you and our children. And again, we appreciate everything you do. Together as a unified group, doing the pillars of prevention, including social distancing, mask wear, and staying home when you're sick. This also includes hand washing. As a team, we can move through this together and do our best to prevent COVID-19 transmission. Again, thank you for your time.
Thank you for joining us today. And as a reminder, the session has been recorded and will be posted to the Louisiana Department of Education's website as well as their YouTube channel. If there are any questions we didn't get to, we'll make sure to create content for those questions and post them so that you all have the guidance that you need. And we'll go ahead and close out on a video that just stands as an example of the way that Children's Hospital New Orleans provided a visual for visitors entering into a new environment to help them know what to expect as far as screening processes and how to keep how we keep the environment clean. Thank you, and we'll look forward to seeing you next time.
Hi, I'm John Nickens, and it's my privilege to serve as CEO and President for Children's Hospital New Orleans. Throughout this COVID-19 crisis, our doctors, our nurses, all our entire staff have been working together to focus on the safety and care of your child.
The last 3 months have been a devastating time for us in the United States and certainly in southern Louisiana. Things like visiting our outpatient clinics or having elective surgery have been delayed because of people's fears for coming in the hospital. We want to take you on a tour today and show you the steps that we're taking to make you feel safe when you come to Children's Hospital.
When patients, families, and visitors enter the hospital, you'll do a quick symptom screening, temp check, and be provided a mask that you can wear during your duration of your stay. If you have a temperature of 100 degrees or higher, you'll be given additional information and steps by our screeners.
Currently, we're allowing 1 visitor for outpatients that come into the facility, 2 visitors for inpatients that come into the facility. When you enter the facility, you will see a variety of items that encourage you to maintain the 6-foot social distance. These include table tents, floor appliques, which are located throughout the facility.
In surgery at Children's Hospital of New Orleans, every patient has a preoperative COVID-19 test performed. We do that as a rapid test for patients who are arriving as outpatients, and we'll do that the morning of surgery or the day of surgery for our inpatients.
Right now, we're taking extra precautions to keep our patients and staff safe. We are going around ensuring that we disinfect doorknobs, light switches, telephones, faucets, water fountains, and handrails.
It is very important that your children continue to get the vaccinations that they need and the well visits with their pediatricians to help ensure that their bodies are staying healthy and their minds are staying healthy.
I've helped care for the children of our community for over 40 years. For all of those years, I've counted on Children's Hospital to provide the very best care for my patients.
As a parent, it's so important for me to take my son in and feel safe.
We remain here for you and proud to serve you. Thank you for choosing Children's Hospital New Orleans. We'll get through this the only way we know how, and that's together.
Thank you, Children's Hospital.